Our guest today is a physician associate that specializes in cosmetic and medical dermatology. Please help me to introduce Aesthetic Injector, Anna.
Hey everyone. So happy to be here. Thank you for having me.
Thanks for coming.
Absolutely.
So Anna, I'm so glad you were coming and able to speak about the aesthetic industry with me. Tell me, how has everything been since COVID-19?
Everything has been, I think, crazier than ever. Definitely very busy, so that's good. I think the industry is experiencing a lot of growth. So even though the world is upside down, the industry of like cosmetic injectables and aesthetic medicine in general is booming.
That's amazing. Yeah, I've seen that a lot of providers tell me that they have seen an increase in patients over the time because everybody's looking at themselves in Zoom and things like that. Is that what you're saying now?
Absolutely. It was funny because at the beginning of the pandemic, I was thinking, I do medical derm as well, and I was like, oh gosh, people are going to stop coming. They're not going to come in. It's going to be all rashes. And then as soon as we opened up, people were like, I haven't left my house in 6 weeks. And I'm like, and you're getting Botox today? I'm like, really? This is it? This is where you're coming?
Yeah.
So if anything, a lot of people have seen themselves in Zoom, and a lot of people weren't traveling. So they were investing that time, I think, in themselves. There's like a big revival, I think, on self-care.
So take us back to the beginning. Before I interviewed you, I love doing research on the person I'm interviewing. And I've seen that you started in plastics. How did you get from there to where you're at right now?
So when I was graduating as a PA, I really wanted to do something in the aesthetic world. That's something that I really knew. I wanted to do cosmetic dermatology. It's something that I really wanted to do. So, you know, it was one of the opportunities that presented itself, and I took it on, and I loved working in plastics. It was great experience. I got to see a lot of aspects of things, even how to treat the patient, how to communicate with them. You know, that it's a lot of different things. So that was great experience.
How did you land your first dermatology opportunity? So many people contact me and say, hey, it's so hard to get into networking.
Yes, absolutely. So I actually shadowed in the practice where I worked, and I shadowed as an actual rotation in PA school, and I loved it. I really visualized myself somewhere like that. So I kept in touch with one of the PAs that still works with me there, and she when the doctor was looking for someone, she introduced me, and I came for an interview, and on that interview process. I always say in this industry, networking is number one. You have to know people, and you have to be willing to talk to people and keep in touch.
Okay, nice. How important do you feel as though branding is in this position as an aesthetic injector or in any position?
I think you are your own brand in this business, absolutely. And I think how you evolve, how you age, how you are, what you put out there is part of your brand. So yeah, branding is everything. I think it's super important. I think that's why Instagram was like a pivotal point with like cosmetic injectors and people in this industry, because it gave us like a platform to be like, hey, you know, this is my audience, these are my patients, these are my potential patients. I don't know, their family, their friends, because people refer you back and forth, and they get to see a piece of who you are, your aesthetic, your taste, your lifestyle, everything.
How did you get your name on Instagram, speaking of Instagram?
So actually it's funny because I just had my Instagram private, and patients started like adding me. And at that point, people started adding me that were injectors in other states and stuff, and I thought that was so cool. I was like, wow, all these people with experience that I could network with. And a friend that does marketing was helping me. So I really wanted to do something that said something like beauty, but medical beauty. So I was like, something with a white coat, because we always wear our white coats and stuff like that, but that was taken. And he was like, you can be the white coat beauty. And I was like, that's pretentious. And he was like, no, it's perfect. You know, that's like your persona. You're the white coat beauty. So I took it on, and I've been that ever since. It's been 4 years next month.
That's really cool, because I do see a lot of providers would brand themselves with special names and things like that, and it really does help, because it makes the client feel, or the customer feel like, hey, I can see them a little bit more. I see their personality, things of that nature.
Oh, absolutely, yeah. They see everything about you. Like I said, even your aesthetic, how your feed looks, how you present yourself. That's all part of how the patient is choosing you.
Wow, that's amazing. What's your favorite aesthetic procedure?
I honestly love them all. I think that they all are like, you know, tools in a tool belt, but I think facial fillers, because that art of sculpting and seeing how products behave on people and kind of what you can change, subtle differences, to me it's amazing. To me it's like when you give someone that mirror and they look back and they love it, or they had an insecurity that you were able to solve, like with a non-surgical nose job. To me that's like magical. It's very rewarding. I'm very visual, so anything that is visual is great.
Now, one of the cool things I found that you're able to do is you're able to place filler all over the body. Can you explain that a little bit more?
Absolutely. So one of my favorite things to do, a few years ago, someone was telling me in Brazil they do a lot of Sculptra in the butt and things like this, and in California they were doing it, and then they started the rumors of like the very famous sisters, you know, these sisters that they were like, oh, she has 50, 60 vials. So I went on to train. I remember it was a crazy training because a doctor came in a limo from another county to train me on this because no one was training. And that's how I got started.
Wow.
Yeah, it's just, you know, it's a very pricey procedure, so not everyone, you know, wants to do it or think it's worth it. A lot of times surgery is better, but it's amazing. I love body contouring. You get to do hips, bums. I have a lot of patients right now that are, you know, like fitness models or people that are models in general on TV that have amazing bodies, but it's those finishing touches that you can do to someone's body that is like, bam.
Wow. What would you suggest, kind of like surgery versus non-aesthetic procedures?
So I think surgery is always going to be, I always tell patients, even with facial fillers and stuff like that, surgery is always going to be the most wow result. But it depends also. There's a lot of patients that don't have the body fat to do liposuction with transfer. So what do you do in that instance? Where do you get it from?
Now, I know you do facial balancing, and that's a big thing. Tell us a little bit about that.
Facial balancing or harmonization is basically we look at your face as a whole. We do like that full assessment, and then I tell you, well, I think that if we, for example, combined a little bit of chin filler with lip, we can do maybe like some threads up here, different things, or temple filler. We can make your face look more harmonious. We can make you look more defined. We can make your jawline look leaner. You know, we can kind of enhance your own bone structure to be the best it can be. That's what facial balancing or harmonization is about.
Amazing, amazing. Now, from an injector's standpoint, how do you feel like the industry is going to change over the next couple of years? What do you see in the trends?
I think a lot of growth. I think I see like specializing in different things, and I see even the concept of getting facial injectables, dermal fillers, lasers, all these things as its own kind of, as its own niche, like almost like this type of clinic where you're gonna come in to do these types of things and we're all ultra specialized. That's what I really like. For example, I like to find things where I'm naturally better at those things and focus on those things, train on that, trying to become better. So I see it growing, but being more specific.
Wow, amazing. And I can agree with you, like niche is where it's at. And aesthetics is so broad right now as a whole, and the industry is not even, I feel like, caught up to what's its potential could be. And I do agree that it will become more niche in each aspect of it.
Absolutely.
Amazing, great. So tell us, how important is training and continuous education as an injector?
It's super important, honestly. If you're not someone that's gonna be committed into investing in yourself, going above and beyond, meaning sometimes you have to be tired, especially when you're starting, and go to those trainings after hours, go on Saturdays, fly out, put your own money together and, you know, get these things going. You're not gonna be good, and you're not gonna be able to grow. I always say if you're not growing, then you're just getting older, and that sucks. It's like, you know, you have to kind of continue improving. You have to work on that. It's super important. If you don't train, it's kind of dangerous in a way.
Because there's so many new things coming out all the time, I would imagine.
Absolutely, and there's different advancements on even techniques. There's new cannulas, there's new ways of doing things, and then you morph what you see from other injectors or from training that you go into your own style, and you know, and you polish yourself that way. But it's super important. If you're not someone that's constantly kind of improving and investing into that, you're not gonna get too far.
Great. And now tell us a little bit about how you got on the top 100 list for best injectors.
So it's funny because I'm in this amazing Instagram pod, and it's like all these incredible injectors, and I'll give you some of their names after.
Nice.
And one of them, I think, nominated, I don't know where she saw it, but she nominated some of us, and Nothing. Other people nominate you, like you put it out in your feed. I nominated some of those same injectors as well because I really admire them. And that was how I came out the first time. A lot of people ask me, do you pay for that? I've never paid a penny to be in any list. I'm very humble. Like, I don't need anyone to be blowing like fake gas into me, but it is cool to see your name there, and the patients really like it. It's a nice recognition. But yeah, other people nominated me.
Wow, that's amazing because I see it all over Instagram all the time. A lot of the injectors I follow are top 100. And I always wonder, like, what does it do for the injector itself? But you said it gives like a good sense of like confidence in the patient when they come see you.
Yeah, I think so. It's everyone wants to be recognized, or at least I think a lot of patients that want quality, which is what I'm trying to give my patients. They want to make sure that they're seeing an injector that is well known, at least for being good and producing. I think producing safe, natural, beautiful results is what I always want for my patients, and to have a positive experience. Like I always tell them, it's not just the price, it's like you got me.
Yeah.
Like, if you're my patient and you have a problem, if you have an issue, if you have questions, you got me.
Yeah. No, I can definitely understand that. So this is the portion I go to Instagram and take some photos and get a little bit more context on it. So the first photo I want to take is the one with you doing a selfie. Can you tell us a little bit about that?
So it's funny, I put thanks for the love because I walked in that morning with my brand new scrubs. They're hot pink, I'm doing it. I walk into the room and the guy was like, wow, you are bright today. And I was like, thanks for the love, bro. Thanks for the love. I was like, I thought I looked cute, but sometimes it's a little much for people.
No, I definitely can understand. How important is office environment, or like working in an office that?
It definitely, it's important. I think having like a good environment and good energy is very important. I'm very protective of the energy around my patient and things like that. So I think getting along with like your teammates and being able to interact is super important.
Nice. Now the second photo I want to talk about is the male jawline. Mm-hmm. Tell us a little bit about that photo in context.
So that patient is actually a patient that flies in from Michigan to get that done. And he is gorgeous. He's a gorgeous guy, but he wanted to have a little more definition. And he even showed me pictures of what he wanted to look like. And I was so proud because he came back after his second session for me to take the after photos, and it looked incredible. And, just that chiseled jawline, that you can cut with like glass kind of jawline, to me is amazing. And I know a lot of males want that. So, I wanted to put it out there to tell other guys like, hey, maybe you weren't born with that super square jawline, but I can give it to you.
What is your demographic changing? Are you getting a lot more males? Tell us about that.
So males, something that is a huge sector. I've always tried to at least, capture some of them. A lot of younger men do want fillers now. They're starting to get their Botox. Older males, I always tell my successful patients, you can't be in this boardroom meeting. You can be the most athletic guy in the world, but if you're not taking care of that face, and I'm not just talking Botox and fillers, I'm talking skin health, sun protection, lasers and stuff like that, you're not getting, the full extent of what you can be. So yeah, it's growing a lot, and I anticipate it growing even more.
Wow, that's interesting, and that's also a niche.
Mm-hmm. It is.
Yeah, right? If you can give one tip, because I know you said skin health, if you can give one tip that everyone can follow that is like the most to go to, what would that be as far as for skin health?
As far as skin health, sun protection. You cannot do any anti-aging without doing sun protection. It's an oxymoron, especially us that we live here in Miami and Florida. The amount of sunlight that you get, even driving a car, I tell my patients, when you sit everywhere there's windows, the devices that we're holding all the time, that all contributes to photoaging. So if you want to do at least one thing, start young and start every single morning using your sun protection. I don't care your ethnicity, I don't care your skin type, everyone can find a sun protection that is good.
Yeah, and I always see that because I follow a lot of injectors, so I scroll down my timeline like, where's sunscreen? My biggest issue, and I don't know if you get patients like this, but I'll wear the sunscreen and it'd be like white all over my face.
So 2 things that can help with that. One of them is finding a different formulation. There's like clear type of sun protection now. Nice. Like for example, Elta MD is one that I recommend for a lot of male patients. It's great. Or also tinted sun protection, but that's where it gets tricky depending on like the person's color. But those are my 2 tips. And then finding something that is not oily, because if you're a man, you usually naturally produce more oil. So you have to find something that's mattifying.
That's a good point. Mm-hmm. I definitely will try that. I'm going to drop that below too. How do you feel like the industry have changed in the South Florida area since you've been practicing?
A lot of growth, a lot more people doing this, a lot more competitive. I think it's always been competitive, but here is extra competitive, right? In every corner, there's a different place doing things. So that's where you have to set yourself apart. I think that's one of the biggest engines that like runs behind me is like, I know that it's, very competitive and I want to be the best. So that's why, like educating yourself, working on yourself, remaining humble, knowing that you can always learn new things. It's important.
Yes, I can definitely agree. Mm-hmm. Education for every field. It's how you stay at the top.
Exactly. You have to keep working on it. If like every single day, it's the same as like working on your own self-development, like personal development. Are you meditating in the morning? Are you at least consuming audiobooks? What are you learning?
Is there any podcasts or anything that you listen to for like motivation or even for like to keep them focused?
So I use like a couple wellness apps. There's one that's called Aura that I love because it has great like meditation for in the morning when you wake up. So sometimes I do the burnout meditation. It's great for healthcare workers. It's like, oh, we know you're burnt out and the pandemic sucks, but like that to me is great to turn on and off my day. And then there's one that's called Headway that is like miniature books, so it's like the most important parts of books.
Yeah.
And it's Audible, so I listen to that.
Wow, yeah, that is great because I listen to a lot of audiobooks. I feel like they help a lot because it keeps your mind focused on what you're trying to achieve, right?
Of course, yeah. You gotta evolve.
Is there any tips that you can give to new people coming into the field or even experienced people that are looking to transition?
I think networking, like we said, is very important, and just grab every learning opportunity at the beginning. If they want to retrain you on the same things and you're getting started, go. Like really be willing to go that extra mile. Like I said, even sometimes you're tired, it's the end of the day, you have to close your schedule a little early, you have to do it on the weekends, be willing to do that. That, and also, I think, trust your ability. So, study, try and be the best you can be, but you have to always have confidence. That's one thing that I've always had from the beginning. If I knew something, you have to be confident because that confidence is what you give to the patient. If a patient thinks that you're hesitating, you're not going to be able to convert, you're not going to be able to treat as many patients.
That is a really good point because I get feedback from all the time from interviews like, this person has so much experience, they're really great, but the confidence is not there. And that's what sells the patient. That's what really makes them buy into you.
Absolutely. If you're not confident in what you're telling them, then they're not going to be confident in you. Like that's something that's like a feel. And especially when you're holding that mirror, going through that consultation, explaining things to a patient, you could be the best injector in the world and you can be telling them all the right things, but if you don't have confidence, they're not gonna go for it.
How did you gain that confidence within you, being like brand new, like starting off, you're like, I don't know if this is right?
No, I think confidence is something that you have to work from within. It's something that you have to work on. Like I said, you have to trust yourself. Obviously study, do what you have to do before, train, be humble. Like I said, don't think that you know everything, but you have to have confidence. And for that, education is important, right? Like we said, read it again. Do you need to read it 3 times? Do you need to play that video 10 times? Maybe you need to do that. Maybe you need to phone a friend.
Yeah. Is there any good like magazines or articles or anything that you follow that you can recommend for like injectors to look into or read consistently?
I think anatomy is very important. So following like educator injectors, and I think that's like very important, like following like doctors that are educators. There's so many people, so kind of plugging into those resources is very important. And I think when you start, definitely having some sort of library. Now even the injectable companies that they didn't have this before, they have wonderful videos like in depth on different techniques, injections. It might not be the most advanced thing in the world, but even those resources are important. I think from the beginning, just grab what you can and plug into people that are educators, because there's a lot of people out there that are wonderful people. They're successful, they have great businesses, and they're out there educating you for free. They're telling you about things that you should do, not do. And like I said, you have to be humble, because even as we see patients throughout time, we learn things, why things migrate, why products look a certain way, and then a couple years later they come to the surface. Sometimes, so there's a lot of people educating on that.
Yeah, I recently saw that now, you can use, they use your own blood to kind of inject back into you as a filler. Mm-hmm. Is that something that you're practicing now?
So we've always had PRF, which is the next step from PRP.
Yeah.
I think it's great for improving skin quality. It's amazing for hair loss, so I do a lot of PRF for hair loss on scalp. It's wonderful also for the under eye area when you're not a great candidate for filler. Let it be because you have bags under your eyes or festoons. You know, there's a lot of different reasons, so it's great for that. It's not a filler per se, but it does improve your skin quality a lot, and it's great.
Wow, it's really great. And to my understanding, the person has to eat correctly and be healthy in order for it to work.
And drink lots of water. We always tell patients, you know, definitely hydration is very important, making sure you're eating a proper diet. I even tell patients now about vitamins. What vitamins are you consuming? Are you know what I mean? Are you in your 30s and in your 40s? Are you not having any multivitamin? Are you not taking zinc? So all these things are important. No, and really it's coaching the patient into that so that you can have great PRP to turn into PRF and inject. So yes, very important.
Now I want to talk a little bit about your medical dermatology side. Do you do anything as far as like Mohs surgery or any of that nature?
No, so we don't do Mohs in office. We have a Mohs surgeon that comes in. That's usually a dermatologist that has an extra training on that. So we have a doctor that does that. But I do general derm. So I have patients for annual skin exams. I do biopsies on the daily, suspicious for cancer, moles. I remove cancerous moles. Certain skin cancers that don't require Mohs, I do them as well. So yeah.
How important was that background going into aesthetics?
I always think it's like that piece that rounds out everything, that skin behavior, learning different topicals that can help, because the power of like the topicals, and I'm talking like prescription medication that are topicals that can transform someone's skin, is super important. Knowing how skin behaves, how to calm it down, to me it's part of it. Even the lasers, I really enjoy doing lasers because of that.
Nice, nice. Is there anyone on Instagram that you can suggest that you follow that you would love that other people can follow to learn a little bit more?
For like patient education, for example, I love April Harrison. She's in Houston. She is wonderful. Dr. Tui Doan, sorry, because she's Asian, I want to say it correctly. She's also wonderful and an educator. There's Lori Robertson that's in California. I can tell you many more, but those are great educators. And like I said, Nicola, and I'll give you her Instagram as well. She's also wonderful, and they're educators. They're out there every week telling you about anatomy, telling you about injection pattern, teaching you things. I watch them every day. I'm like at lunch, like, wow, yes, I'm still learning, yes.
So community is really big in this industry.
Yes, community is huge. To me, community is everything. Like literally, like I said, phoning a friend is one of the most important things. I always tell injectors, I'm like, if you ever get an occlusion, if something bad happens, I mean, obviously act on the moment, but phone a friend, like ask someone else, because, you know, taking pictures, following up that patient, that experience is what gets you through. So community is everything.
Can you explain a vascular occlusion a little bit more in depth?
So a vascular occlusion is basically the risk that any patient has. It's a very, very, very minuscule risk of getting filler inside of one of their blood vessels in the face. So if that filler occludes that vessel, then the circulation is compromised, right? And there could be, you know, wounds and different things that can happen. It's a very small risk. That's why it's so important for the injector to know their anatomy properly and to practice safe injection technique. But literally it can happen to anyone that injects.
That's why the education and training is so important, so you know exactly what to do in that moment.
Yes, and I always tell patients, for example, like my job is not a regular job. I'm not the regular mom that you can call 6 times a day to ask her different things. When I'm with you and I'm injecting you, my eyes are on you the whole time. I'm watching capillary refill, you know, if you have pain, anything that is abnormal. So you have to be on top of that. And you have to be always watchful and careful. If you're that way, it's very safe.
Because this job is not really ordinary, it's kind of not the ordinary, how big is like separating the personal and kind of work-life balance?
I think that's why I like, you know, the format of this job versus, for example, I'm a healthcare worker at the end of the day, right? So I don't work in the ER. I have a much better life balance, boundaries, a schedule. So, you know, I think it's one of the things that I enjoy the most, but you do have to disconnect. At the end of the day, sometimes I'm exhausted. I don't want to talk to even my kids. I'm tired. I don't want to talk. But in general, I have a great schedule. I can't complain, you know?
Yeah, and the reason I ask that because a lot of injectors I meet, they start off, you know, without a family, and then they get engaged, they get married, they start a family, and they're trying to balance all of that at once with the social media, everything, and you seem to do it really well.
It's a struggle sometimes. Some days I'm really tired. A lot of times I don't have content to produce because if I don't feel inspired, if I don't have the time, or if I'm exhausted and I don't have things to do, you have to live your life at the end of the day. You can't be stuck to a cell phone. I refuse, for example, to live my life telling people my every move, but at the same time it's super important, right? So, you know, you have to find that balance. When you can do it, when you have the time, when you have the energy, you do it. But if you don't, then you dedicate that time to your family. At the end of the day, your family is who's going to be there when you're older and retired and all that.
For sure. All right, so I have one more question for you. How important do you think sales is in this industry?
Sales is super important, and it goes back to confidence, right? Like when I'm talking to you, when I do an aesthetic assessment for you or for anyone, I'm literally selling you something. It has to come though from a place in the heart and a place in your ethic where you would never sell anyone anything that is not right for them, because to me that I take very serious. But you're selling. You're selling. You're literally telling people, I can do this for you and you can achieve this or that, or I can make that insecurity better, or, you know, I can make you look sexy, or whatever it is that you want.
That's great, because there's some people that don't have that ethics and they'll just literally sell anything.
No. And if you want to be here for the long haul, if you want to make a couple bucks for a couple years, do this, try it out, maybe you'll move on to something else, you'll move town, fine. But if you want to be here for the long haul, you know, what you tell the patient and what you advise them, and even telling them, no, you don't need that, let's work on something else, let's do something else, come back 6 months later, that's very important.
Amazing. Well, thank you so much for sitting down and talking to me a little bit about the aesthetic industry and your passion. Go ahead and tell everybody where they can find you and what you have planned next.
So, lots of great plans actually. But you can find me on the White Coat Beauty. I'm there. I'm also on TikTok, very little, because
that's so nice.
It's a whole other ballpark. You know, it turns into another ballpark. But yeah, any questions that you have, literally in my Instagram, you can find all my contact. You can email me. I even do online pre-assessments, which I love to do for patients. It's completely free.
Wow.
I send you like a format of pictures that I need. I can give you exactly what you want. Yeah, I get a lot of international patients and out-of-town patients that way, because, you know, people love that pre-assessment, kind of knowing everything that you need, instead of you sitting in a chair and just going, I want lips. Okay, no, let me see what you need and what we can do for you.
Amazing. Well, until next time, goodbye.